All set for your flight?
Yep, I've got everything I need. Eye mask, neck pillow, T-Mobile, headphones.
Wait, T-Mobile?
You bet. Free in-flight Wi-Fi. 15% off all Hilton brands. I never go anywhere without T-Mobile. Same goes from a water bottle, chewing gum, nail clippers,
Okay,
passport.
I'm gonna leave you to it.
Find out how you can experience travel better at T-Mobile.com/travel.
Qualifying plan required. Wi-Fi were available on select U.S. airlines. Deposit and Hilton Honors membership required for 15% discount. Terms and conditions apply.
Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips on how to thrive in nursing school and at the bedside. So it is summer. Welcome to summer. And I don't know about you, but I am full on in vacation mode. And I toyed with the idea of going to every 2 weeks for the summer with the podcast, but that didn't feel right to me. And since I get so many questions emailed to me, sent to me on social media, asked in my Thriving Nursing Students Facebook group, I thought I would take all those questions that I get all the time and do a special Ask Me Anything series for the summer. So every other week will be a special Ask Me Anything episode, and then the alternating weeks will be more educational content. So I'm really excited about this series, and I can't wait to answer your questions. You can send those to me at team@straightanursingstudent.com or by using the contact form on the website, or of course on social media. So before we dive into this episode, let's take a quick minute for our listener shout out, and this one goes out to Kelsey. And Kelsey says, I'm an experienced nurse with 5+ years at the bedside. I'm starting in the ER soon, and that's coming off of maternity leave. I feel out of touch and nervous, and this has been the exact podcast I'm looking for. It has been such a great refresher and is getting my brain turned back on before I go back. I love this podcast, and I'm not even a student. Kelsey, thank you so much for taking the time to share that. This podcast is for nursing students and working nurses because honestly, I do believe as nurses, we are always learning. We never, ever stop being a student. And congratulations, sounds like you just had a little one. I hope that that is going well. All right, you ready to get into this Ask Me Anything? Let's start off with this question from Ajne, who says, do you have any study tips for maternal, newborn, and pediatrics? So here's what I have to say about this. And I see this asked all the time. And this is before students even get into these classes. Like it's coming up for you next semester, for example. And I see students getting all stressed out about, oh my gosh, I have no idea how to study for maternal, newborn, or for pediatrics. What I will say is that you already know how to study for nursing school because by the time you get to maternal newborn, by the time you get to peds, you've already proven yourself in your other semesters, right? So I want you to kind of get out of your head if you notice yourself starting to get all stressed out about this upcoming class. Take a breath and remind yourself you already know how to do this. So let's first dive into maternal newborn specifically. And when we look at maternal newborn, I don't want you to get freaked out. I want you to think of it as a subspecialty of med-surg because really that's what it is. Maternal newborn deals with medical issues. It deals with surgical issues. It is a med-surg specialty. And guess what? You've already rocked med-surg. You probably already rocked advanced med-surg. So 2 med-surg classes if your school, puts things in the same order that mine did. We did med-surg 1, then med-surg 2, and then peds and OB after that. So the good news is you already understand med-surg. You can 1000% understand and learn maternal newborn. And with any class like this, I always tell students, it's really, really vital that the first thing you understand is normal anatomy, and physiology. When you really know that foundation, it makes it so much easier to learn the pathophysiology or the abnormal findings. So when you get into your maternal newborn class, it's going to start off with some foundation lessons. And these definitely are really, really important. Probably maybe not as exciting for you as talking about like the high risk labor and delivery and all of that stuff, but don't ignore or brush off these foundation lessons. You want to understand normal anatomy, all the different pelvic shapes, for example, how to do a fundal assessment, all the stages of labor, all those normal things. Learning about low risk or a healthy pregnancy and delivery is going to really help you understand what's going on when there's a situation where something is abnormal or high risk. And I do review low risk labor and delivery for you in episode 146. And I'll put a link to that in the episode notes in case you're driving and you're not going to jot that down. You can just scroll to that when you get to your destination and see which one that is. It is episode 146. So that'll help you get that foundation. And then as you learn the abnormals or the pathophysiology, I don't want you to talk yourself into thinking, oh my gosh, this is so overly complicated. Guess what? You can learn these just like you learned about pneumonia, just like you learned about heart failure. You knew the normals, you knew normal physiology, and then you learned the pathophysiology and everything that comes with that. So what do I mean by that? What is the everything that comes with that? So you're going to know the basic pathophysiology of the condition in maternal newborn, the signs and symptoms that the individual would have, your nursing assessments, and what you are going to do about it or your nursing interventions. Isn't that exactly how you approached pneumonia or heart failure? So it's no different. Basically, what we're using here is the straight A nursing latte method. And if you want to see that in action, check out episode 244, where I talk you through polyhydramnios, which is an abnormal situation in a pregnancy. We're going to go through that with the straight A nursing latte method. This is the exact same method I use for pneumonia, for example. Again, because maternal newborn is a specialty of med surg. Now, there will be some things you just have to commit to memory. Maybe things like torch infections, what each of those letters stands for. You're going to make flashcards for stuff like this, right? Or you could use the ones in the Straight A Nursing app. For example, I have a flashcard app where they're all made for you. Or you could listen to Study Sesh, which is another podcast that I have where we do pod quizzes. So flashcards are a great way to help you kind of just memorize those little tidbits of information that you need to commit to memory. Now, in general, I just want to say, don't feel like you have to completely change how you study to survive or even thrive in maternal newborn. Again, it is a specialty of med surg, and that is it. Now, of course, if you struggled in med surg, then yeah, you may need to adjust how you study med surg conditions overall. And that's simply because if you struggled, maybe your study methods weren't really effective or working for you specifically. So think about that. If you did well in med surg, use your same tactics for maternal newborn. And a great way to start, if you're not sure where to start and how to study, is to use the Straight A Nursing latte method. Now, I've got a template that I link to in the episode notes so that you can print that and fill it out anytime you're learning a new disease condition. And if you want to go in the way back machine and go all the way back to episode 21 of this podcast, I talk through how to use the latte method in detail. You'll also get an introduction to it in Crucial Concepts Bootcamp if you've been eyeing that program. And you can also just listen to a lot of episodes on this podcast where I use the latte method. And just the very short version of that is it helps you focus in on what you need to know as the nurse. So for a maternal newborn situation, L is going to be, how does the patient look? So basically, what signs and symptoms are you looking for in this patient? A is for assess. What will be your key assessments? The first T is for tests, looking at the diagnostic tests, imaging studies, lab tests, things like that, so that you know what is going to be ordered. And then the second T is for treatments. Basically, what are we going to do to help this person out? And then E is for key patient education. So that is an overview of the latte method. I go into it in more detail in episode 21 and in boot camp. And again, you can hear lots of examples of it on this podcast. And if you want to hear it utilized for a maternal newborn condition, go and listen to the episode on polyhydramnios, which was episode 244. Okay, so are you in agreement with me that you're not going to let maternal newborn completely upend your life? You got through med-surg, you're going to be able to get through this class as well. All right, now let's talk about pediatrics. Students get really nervous about pediatrics as well. Guess what? Peds is med-surg for little people, okay? It is med-surg for little people. It's pretty much the exact same. Of course, there are a few key differences. So let's talk about what those key differences are. One of those is that developmental stages will be way, way, way more prominent in pediatrics than they are with your adult med-surg population. So you'll want to brush up on those, Erickson and Freud's developmental stages. Lots of exam questions will be coming at it from a developmental stage standpoint. And then vital signs. This is the one that always tripped me up. I gave up trying to memorize them. I would memorize them for exams and then they would fly out of my head. And for clinical, I just made a little cheat sheet that I carried in my pocket because vital signs in children vary widely based on their age, their heart rate, their respiratory rate. Their blood pressure is going to vary widely depending on what their age is. For example, a 3-day-old infant could have a blood pressure of 75/40, and that's totally normal. If you had a 60-year-old patient with that blood pressure, you'd be super concerned, right? So the variability in vital signs is another thing that makes peds a little bit unique. And then there are some specific childhood diseases. So there are going to be conditions you'll learn about in pediatrics that you don't learn about in adult med-surg. And again, you're going to learn about them in the same way. Again, peds is med-surg for little people. Some common disease conditions, for example, would be otitis media or whooping cough or Kawasaki disease. Again, you're going to learn about these the same way you learned about pneumonia, the same way you learned about heart failure. So I want you to take a breath. If you're really nervous about going into maternal newborn and pediatrics, take a breath. Remind yourself, hey, I got through med-surg. In fact, I did great in med-surg, and I'm going to do great in these classes as well. Now, different instructors, of course, could teach things in different ways, but that's true for any class that you take. Some might use a flipped classroom. Some might pull exam questions straight out of the book. Others might lecture and then pull test questions from the lecture. But these variabilities in teaching style don't make maternal newborn or pediatrics any different from learning about other disease conditions. And again, when you're looking at disease conditions, what are you doing as the nurse? You're looking for problems and you're doing something about it. That's it. Okay, so that was our first question, and thank you for sending that in. Next, we have a question from Amanda asking what it's like to go from LPN to RN because she wants to start working as a nurse as soon as possible. So this is actually a fantastic route to take. There are so many different routes and pathways to get to that registered nurse status, that registered nurse title, and starting out as an LPN is a great option. So some benefits of going this route are that in a lot of cases, LPN schools may not be as impacted as associate's degree of nursing or ADN schools or BSN RN programs. So you may have an opportunity to get into one more quickly. Many LPN programs are on the shorter side, 12 to 18 months, which means you're spending less money overall and you're getting to work faster and earning money faster. Now, some LPN schools will kind of blend the prereqs into the program, so those schools may not require prerequisites. Many of them do, but the number of prerequisites is not going to be as many as you would have to take for an RN, an ADN, or a BSN program. So some common prereqs for an LPN program might be anatomy and physiology, and you may not have to take the one with the lab. It will depend. It might just be like an intro to anatomy and physiology class that could suffice. I saw nutrition listed, psychology, just a general psychology class, like just intro to psychology or something like that. Medical terminology could be a very common prereq that's required, and human development. So again, not as many prereqs as a BSN or ADM program, but a few, and in some cases, maybe they're blended into the program. When they're blended into the program, that program's probably going to be a little bit on the longer side, and when they're not blended in, the program itself will be a bit faster. Now, another great benefit of this LPN route option is that, guess what? You're going to go to LPN school, you're going to get out of LPN school, you're going to get licensed as an LPN and be working as a nurse much faster, which means you could be working as a nurse while you're getting to that RN. And that is great. If you have a family, if you need to be making money and you don't have a ton of time, I mean, it took me 5 years, start to finish, to do all the prereqs and get through nursing school. 5 years where I did not work. So that's not possible for a lot of people. So if you need to be earning money, then LPN is a fantastic, fantastic option. And then you take an LPN to RN bridge program. You enroll in a program like that. And that is usually about 30 units. And a lot of these will be done. For example, the one that I was looking at was the LPN to RN bridge program at the university that I attended. Now, this does not mean that you get a BSN. This is just getting you to be able to take your licensing exam for the RN. To get a BSN, you would have to satisfy additional requirements from the university. So I wanted to be clear about that. And then in some cases, you will have to take some prereqs for an LPN to RN program. For example, the university that I attended for my BSN requires A&P with a lab and microbiology with a lab. So if you didn't take those before your LPN program, then you'll need to take those classes before you can enroll in that bridge program. And then the types of classes that you would take in a bridge program are going to be things like advanced med surg, mental health nursing, maternal, newborn, and pediatrics, like those specialty classes. So again, there are many paths to getting your RN license, and LPN to RN is just one of them. So if it's something you've been thinking about, maybe explore that, because I do think it is an excellent option. I've known so many nurses who went that route, and they are fantastic, fantastic nurses. All right, before we hop into the next question, which deals with isolation and loneliness, which a lot of nursing students can experience, let's take a quick minute for a break, and then we'll come back for that.
Your brain needs support, and new Ollie Brainy Chews are a delightful way to take care of your cognitive health. Made with scientifically backed ingredients like Thai ginger, L-theanine, and caffeine, Brainy Chews support healthy brain function and help you find your focus, stay chill, or get energized. Be kind to your mind and get these nootropic chews at ollie.com. That's OLLY.com. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
So this question was submitted anonymously, so I don't have a name for this one, but I do think that it is something that a lot of students experience. And this is feelings of loneliness and isolation. And that's because the nursing students have a really busy schedule and they study a lot. So how do we cope with those feelings of isolation and loneliness? So again, this can be very difficult for a lot of students. If you're worried about this or dealing with this, I want you to know you're not alone. This happens to a lot of students. Nursing school can be a lonely experience. And if you are the type of person who needs to connect with other people, connect with your family, connect with your friends, which is most of us, then you could have some periods where you feel loneliness and isolation. So, a few tips that I have to help you maybe not have that be as impactful are number one, make some friends in nursing school and study with them. I'm not saying have a big study group. I've talked a lot about how I feel about study groups and how they end up mostly being a giant waste of time. But study with one other person, maybe two other people, not even maybe even a study group where you're talking with one another, but even just let's meet in the library. We'll sit together. We'll have some kind of connection. We can ask each other questions if they come up, but we just have this camaraderie. Or you could, of course, have a more formalized study group situation. So that's tip number one, simply studying with somebody else from your cohort. And then tip number two would be to actually get out your calendar, because if we don't plan things, they don't happen, and schedule some power social activities with your friends. And when I say a power social activity, I mean a short and sweet and impactful session where you spend quality time together, but then you can get back to work. So, for example, a great method and one that I loved using was I loved going to coffee shops to study because I honestly would get super bored of always being in my study space at home. I just needed to be out once in a while. So I would take my books and I would study at a coffee shop for a few hours and then meet a friend, have a friend meet me there. We have a 30 or 40-minute, let's catch up, let's chat, let's not talk about school, let's just socialize, and then it's get back to work time. So if you have that as an option, if you have a friend that will respect your boundaries, because I don't know about you, I'll get to chatting and easily want to blow off the rest of the day, but a friend who's like, nope, it's time for you to get back to studying. It was great to see you. I'll see you next week. If you did that every Sunday with a friend, that would be fantastic, right? So you could schedule these types of things so that they kind of dovetail in with your study sessions. And then tip number three, kind of along the same lines, is just simply scheduling time to be with your family and friends, just as you would schedule time to study. So if you've gone through my boot camp, my Crucial Concepts boot camp, then you know I talk a lot about how to plan out your schedule. And I talk about your non-negotiables. And those non-negotiables are those things that are not going to budge for nursing school. You are giving them attention first. And I would say scheduling social time with people that you enjoy is probably one of the best non-negotiables you can have, right up there with getting some really good sleep. So schedule that time and don't feel bad about it. Don't feel guilty about it. Don't think, oh man, I should be studying. Go and have fun. I'm not saying it has to be the whole day, but you do want to have that time set aside. So one way that you can make this happen is to be really honest with yourself when you look at how you're spending your time and looking for time wasters. For example, for me, a huge time waster is hopping onto social media, and before I know it, I've scrolled on Instagram for 30 minutes. I mean, I'm a sucker for a good Instagram ad. I cannot tell you how many cool products I have found because of Instagram. But really, do I need to be doing that for 30 minutes a day? No. So think about, I think I probably scroll social media for 20 minutes every morning or every afternoon or at night before I go to bed. If you skipped that, you would save about 2.3 hours a week. What could you get done in 2.3 hours? You could meet a friend for dinner. You could go on a hike with your spouse. You could even get a movie in or play a game of soccer. Like you could do all kinds of things in 2.3 hours. So first off, I would just say be really honest about things that are wasting your time, that aren't really giving you back a lot of enjoyment. and see if you can instead use that time more purposefully and more joyfully. And then the other thing I would say to that is if you're studying all the time, there is a chance you are overstudying. So if you're studying along and your brain's not engaged, you're not having these like connections happening or what I call aha moments, either you're super burned out and probably shouldn't be studying right now anyway because nothing's clicking, or you are reviewing material that you already know. So regardless, if you find that you're not having a solidly connected and engaged study session, you're either disconnected and need a break, or you're studying things you already know. Both are great excuses to take a pause and go do something enjoyable for an hour and then come back to it. And then another tip is, you're in the trenches, you're feeling lonely, you're feeling isolated, just stay connected with your friends. Send them text messages, send them voice text messages, and then you can talk and they can hear your voice, and then hopefully they send you voice messages back and you can hear their voice. And I think that's just a much more meaningful way to connect with somebody. Maybe if you don't have time to chat on the phone, sending a voice text is a little bit more intimate, I guess, more of a closeness than just sending a plain text message. So that would be my other quick little tip, just for a quick little pick me up during the day. All right. Thank you for sending that in, anonymous person. Next, I have a question from Tommy who asks, how long are clinical days? This is a great question because clinical is where a lot of learning happens. A ton of learning happens, but it's also kind of stressful and kind of exhausting. So clinical day lengths are really going to vary. And this has a lot to do with the hospital's agreement with the school, how many clinical hours your school has to provide for your board of registered nursing, and how all of that works out. So I can speak from my experience as a clinical instructor. My students had clinical from 6:45 a.m. to 14:15. So what was that, about 7.5 hours or so? And then they would have post-conference for about 45 minutes to an hour. And that was 1 day a week. And then that was for a first semester cohort. At the school where I teach, the second semester students do advanced med-surg for half the semester, advanced med-surg clinicals for half the semester, and then mental health clinicals for half the semester. So advanced med-surg clinicals are 2 days a week, and I think it's again about 7.5 hours. And then I have heard of schools that do full 12-hour days as well. So again, it really does vary a lot. It's going to be anywhere between 7-ish to 12 hours. It's going to be 1 to 2 days per week. I love teaching clinical. It is absolutely amazing to see students go from not knowing anything to feeling like things are clicking. They're really getting into their assessments and their interventions and all of that, and they grow massively in a very short amount of time. It's a ton of learning on the student's part, and those clinical days are absolutely gold when it comes to learning. So Tommy, I hope you enjoy your clinical very much. All right, our final question in this Ask Me Anything is from Danielle, who says, I am taking the NCLEX. My classmate said it was really, really hard. Any advice? So first thing I would say, Danielle, is just because the NCLEX was really hard for your classmate does not mean it's going to be really hard for you. Everybody has their own experience. Now, what I would say is the way the NCLEX is designed, it's adaptive testing, meaning that whenever you answer a question correctly, guess what happens? It's going to give you a bit of a harder question. So it's always pushing you all the way up to the limits of your knowledge and abilities. So yeah, for most people, this feels challenging. But you know what? That's okay. It's absolutely going to be okay. Look at your school's NCLEX pass rate. So if your school's NCLEX pass rate is 99%, then they are doing an excellent job of preparing you for this exam. So most likely, as long as you're doing all the things you need to do to satisfy your school requirements, you're going to do great on the NCLEX, okay? you want to prepare, obviously. So doing all those things that your school requires. You might want to dive into a NCLEX prep program. If your school doesn't use one, you might want to get that on your own. A lot of students do. I didn't. I believe I used some ATI materials because my school used ATI at the time. But there's Kaplan, there's Archer, there's UWorld, there's all that kind of stuff. And you want to practice. And by practice, I mean practice doing NCLEX style questions. And hopefully you're not just practicing those NCLEX style questions at the very end of your nursing program. You should be starting and practicing those style of questions in first semester because your nursing school exams use that style of questioning on all the exams. That's how your school is preparing you for the NCLEX. So practice tests, really, really important. And even if you get a question and it seemed easy and you got it right, do not skip the rationales. Even if you got the question right and it seemed easy, go ahead and read the rationales for why the correct answer was correct. You might learn a little something extra, and why the other answers were incorrect. I cannot tell you how many amazing things I have learned from reviewing the rationales. And what I like to do when I am going through that is if I learn something new or something that I'm like, oh yeah, I kind of remember that, but I really want to make sure I do remember that, is I would just write it down. And I had this really long list of like just random med-surg facts or random pediatric facts. And I made flashcards out of these and I just reviewed them periodically. So that was another little tidbit. It helped keep me engaged as I was reading those rationales. And again, helped me remember those little tidbits of information. So again, another note really quickly about preparing. Your notes from nursing school are a fabulous resource for preparing for the NCLEX. You can listen to this podcast. Many students listen to this podcast to prepare for NCLEX. You could use Study Sesh, which is my other podcast that uses pod quizzes and things like that, and drills and case studies to really hone in and just really get that information into your head. You could use my Straight A Nursing flashcard app if you're the type of person who likes to do flashcards. And again, you're doing practice questions. Just get an NCLEX review book. You don't have to sign up for an expensive program if you don't want to. You can just get an NCLEX book from the bookstore and do the practice questions in that. All right, so thank you for sending in questions for this first Ask Me Anything. That was really fun for me. I want you to send in more because we're doing this every other week for the summer. Got some fun questions coming up for next week, looking at preparing for critical care and preparing for mental health. What do we stock in our book bags? All kinds of fun things like that. So keep the questions coming in, and I look forward to seeing you back here next week and then the week after that for another Ask Me Anything. See you soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.